Did you know that 20% of women will be diagnosed with an autoimmune disease like rheumatoid arthritis in their lifetime? And 100% of people will be diagnosed with osteoarthritis in their lifetime.
You're watching the Dr. Jake podcast.
I'm Dr. Jake. I'm an naturopathic medical doctor and integrative physician in Salt Lake City, Utah. On this channel, I'll share with you how you can heal your body down to the root cause, get your energy back without any harmful drugs or surgery. Be sure to subscribe for more videos like this one. So let's begin. On this video, I'm going to share with you the different types of arthritis, what are their causes, and how to treat them. So the main ones I'm going to be talking about today is one is called osteoarthritis, another is called rheumatoid arthritis. Like you said, rheumatoid arthritis is an autoimmune condition and osteoarthritis is not an autoimmune condition, but both are inflammatory diseases of the joints. So osteoarthritis is usually the disease we talk about when you get old and your joints hurt. That's osteoarthritis. It's a degenerative change that's happening inside the joint. You're losing your little cushion pad inside your joint, so then your bones start not having that cushion anymore, so it's going to be painful when you get out of the chair, walk up the stairs, or go running or whatever, is because you don't have that cushion pad anymore. Now, that is an inflammatory issue going on, and it's likely related to a poor diet and many other factors, and we'll dive into that later. And then we have rheumatoid arthritis, which is the autoimmune condition. Your immune system is attacking the joint space, and there's multiple causes for that happening. And that can happen in any joint with rheumatoid arthritis throughout your body. Rheumatoid arthritis is going to be much more severe, and it's going to degenerate the joint much more quickly if you don't get it taken under control. So I would just say that the severity is going to be much more painful with rheumatoid arthritis compared to osteoarthritis, and the degenerative changes are going to be much more quick with the rheumatoid arthritis compared to osteo. Osteoarthritis is very slow. Rheumatoid arthritis can cause damage very quickly. So the pain differences and the degenerative changes that happen. Also, the look of what happens to like your hands and things with rheumatoid arthritis, we call it the swan neck. Moves your hands kind of outward and gives it kind of looking like a swan neck. That does not happen with osteoarthritis, but it does happen with rheumatoid arthritis. They are quite a bit different. They just both affect the joints. So rheumatoid arthritis could start in your 20s and it can go up to your 60s. Usually you're not diagnosed with rheumatoid arthritis in your 60s, but it does happen. And I have some of my patients that have gotten that diagnosis that late. You also have something called juvenile arthritis. We don't call it rheumatoid arthritis, but it's juvenile arthritis. It's the same type of thing as rheumatoid arthritis, except it happens in a child, and that can happen from as early as 1 year old. So it could start very young. And osteoarthritis can start like in your 40s. It's more common in your 50s. So there is osteoarthritis, and what happens is as you age, your cartilage starts to break down, and there are many things that can make that go more quickly, and it's many times related to the lifestyle we are living. So many times people that are more active are going to tend to have more osteoarthritis than others. Now, this does not mean that we need to stop being active, but we need to be following a good diet on top of being active. So let's say you have a poor diet, you're eating a lot of poor quality meats, you're eating a ton of sugar, which is then causing a chronic inflammatory response in our body, which is then going to cause damage to our joints and also make us not be able to heal and regenerate very well inside our joint spaces. So then if you're running all the time, you're going to degenerate your knees, or if you're using your hands a lot, you're going to degenerate the joints in your hands. And this is usually a gradual process, and you start noticing it as you're older because of that degeneration that's continuing to happen. But a big cause of why this is happening is, the biggest one of all, is you're eating an inflammatory diet, or the SAD diet. Standard American diet is a big cause of osteoarthritis. And if you're eating those bad foods, you're going to likely get osteoarthritis. Now, even if you're going to live a good, perfect lifestyle, most people as you age are going to get some form of osteoarthritis. There's going to be some degeneration that happens. There's nothing you can do absolutely about that. If you're going to get to 70 and 80 years old, you're going to have something there that's degenerating because your body is going to start breaking down. That's what happens with the aging process. but you could greatly decrease that aging process and how early it shows up through following a good lifestyle. And also being active is going to help with that and keep things lubricated. Also, you want to make sure that you are actually stretching and keeping yourself limber, because if you're not stretching and keeping yourself limber, that's going to affect how you press on the joints and your form of how you press on the joints. And if you have like imbalances of your form, it's going to press on the joint inappropriately on different areas of the joint space, and that's going to lead to osteoarthritis in that area. So that's the rundown of osteoarthritis. Rheumatoid arthritis is completely different, and my treatment approach, I guess not completely different because I do dietary changes, but it's not in the same way. So it's an autoimmune condition. Your immune system is attacking the joints throughout your entire body. Most common areas are like your hands, your wrists, your knees. Very common can be your ankles and elbows, but it can attack any joint throughout your body. What we want to do is identify why the immune system is attacking the joints. So there's multiple reasons this could be happening. It could be related to, let's say you got exposed to an infection and then it reactivates itself. Or you got exposed to an infection and it just hanged out for a while and just kept on causing damage throughout your body and causing an imbalance of your immune system. Some common infections that can do that is Epstein-Barr virus, cytomegalovirus, chronic strep, mycoplasma pneumonia, HHV6, Lyme disease. This is just a quick list of what can happen, but all these diseases cause your immune system to be hyperstimulated. So what happens is, okay, your immune system starts seeing this bug that's hanging out in there that's not supposed to be there. It's foreign material. It's reactivated. Now it's showing up. And now your immune system's going to keep on going attacking at it. And what happens later is that it then cross-reacts with certain proteins in our body, like in rheumatoid arthritis, going to interact with the proteins inside our joint spaces. Then your immune system is going to see our joint spaces as foreign material, and it's going to start attacking it. We want to identify these bugs and attack these bugs to put them back into remission so they're not causing problems anymore. We also, big piece, and probably the biggest of all, is our gut health. We need to make sure that we aren't eating a food that is causing a reaction in our body, an allergic reaction or an inflammatory reaction. I have never treated a rheumatoid arthritis patient that I've tested for an allergic reaction to a food that they haven't had one. They always have some type of reaction, if it's gluten, dairy, corn, soy, chocolate. It could be really healthy foods like broccoli and kale and apples. We just need to identify that food and eliminate those foods that are causing that allergic inflammatory reaction, because if we don't, the immune system is going to continue attacking it. And then we need to start healing up the gut is a big piece too. We need to do some glutamine, we need to do some probiotics, we need to maybe do some quercetin to calm down the inflammatory allergic reactions to get that gut healed up. Because what happens is the gut gets damaged, there's a leaky gut syndrome or increased intestinal permeability going on, and that's making certain foods that aren't supposed to be in our bloodstream get in there, or any toxic material, whatever gets in there. And again, that's going to make our immune system go crazy because seeing all this foreign material make everything worse. We're going to do these treatments to seal up these gap junctions that are causing the leaky gut syndrome. Big thing is gastrointestinal bugs is a huge one too, like small intestinal bacterial overgrowth. We're going to diagnose that and treat that. We don't want to rule out if you have certain parasites. We want to make sure that you have a good amount of good bacteria in there compared to bad bacteria. If you have certain bad bacteria that aren't supposed to be in your colon or small intestine, we need to eliminate that, because that's a big thing causing damage to your gut. Could be a cause of the allergic reactions that are happening too throughout your body and leading to that leaky gut syndrome. Also, your immune system is going to see these bugs, get hyperstimulated, and the more stimulated our immune system becomes, the more potential it's going to have to cross-react with many other proteins. Rheumatoid arthritis, it's not like you only have rheumatoid arthritis, you have increased risk of getting all kinds of other autoimmune conditions, so it's important in that way. Also, we need to rule out other toxins like pesticides, herbicides. Heavy metals is very common, like mercury, arsenic, lead. These are all things that can make your immune system get hyperstimulated and lead to the autoimmune condition. So that's just a quick rundown. Our emotional well-being is very important. Depression, anxiety, we need to get that under control because that will affect our immune systems too. So that's a quick rundown of how we go after treating osteoarthritis or rheumatoid arthritis. And treatments are just based on treating these causes. First is we eliminate the cause, we treat the damage that has been caused by the cause, and then you heal up, and then the disease is gone. So that's how we go after treating these conditions and treating the root cause. I have seen it personally in my office is when we improve their hormones and do all kinds of other things, but improve their hormones is a big piece. I see people's joint pains greatly improve. I think a big piece of that is your whole inflammatory cascade, your whole immune system's out of whack when you're not getting the appropriate signals from your estrogen, progesterone, testosterone anymore. So when I put people on bioidentical hormones when they have osteoarthritis, I see it greatly improve. I haven't seen a ton of research on it that it decreases degeneration, but it does decrease inflammation. And a big reason for the increased degeneration is the inflammation that's happening inside the joint. So it makes a lot of sense. I just haven't seen a lot of research on there. But it does definitely improve our bone health, which is a piece of our joint health too. So yeah, the conventional approach is to solely treat the symptoms of what's going on. So the problem is okay with osteoarthritis, it's inflammatory. So we're going to give you some anti-inflammatory agents, usually NSAIDs, like let's say aspirin or ibuprofen or Tylenol, whatever. These things are going to decrease that inflammatory response and improve it. But the interesting thing about it is it leads to further degeneration. Also, like a common thing for osteoarthritis is to do a steroid shot inside a knee or a hip or whatever areas that's a problem. Yeah, that helps the pain for a short term, but what happens? It causes further degeneration. I never recommend my patients get more than one. I really don't want them to even get one because it doesn't really help long term, and it's just going to lead to further degeneration of that joint. It's just a band-aid of, and then later you're just going to need to get surgery. So that's what it's doing. Conventional medicine, decreasing inflammation, not treating the cause that's going on. These medications actually cause further degeneration inside the joint space, and then you're just going to have to get a total knee replacement, hip replacement, shoulder replacement, whatever that many elderly people know about is what happens is because you're not really treating what's going on. But you can prevent all these things from happening from actually doing effective treatments, changing your lifestyle, exercising appropriately, decreasing your inflammation state. And also you could do certain some regenerative injection techniques instead of like a steroid shot that's actually going to regenerate and heal it, like platelet plasma or prolozone or stem cell therapy that can actually heal that osteoarthritis. So there's a lot of things you could do besides just suppressing the symptoms, but in conventional medicine, they don't really dive into that. Their big goal is really just to suppress the symptoms. Rheumatoid arthritis, a huge thing here, and what they use is stronger medications that are going to inhibit the immune system greatly. They sometimes use systemic prednisone, which is the worst of them all. A lot of conventional docs don't like to do that, which I give them credit for because they know all the side effects that happen with that, but they still do prescribe them. Or they go with biologics like Humira, which is still suppressing the immune system, which is going to make you at more risk of getting cancer or bad infections, but also it's going to decrease your ability to be able to heal. And then we need our immune system for so many different things throughout our bodies. Many times we think, okay, we need our immune system just to kill off bugs. That's definitely not true. We see that we need our immune system to maintain even our mood. Our anxiety and depression is related to our immunological function. So if you suppress these things, you're going to affect how the entire body works. So what conventional medicine says, okay, we are treating the cause because the immune system is attacking, let's say in rheumatoid arthritis, is attacking the joint. So what we need to do is we need to suppress that immunological function. But a integrative physician is going to go a lot further and not just be like, okay, immune system's attacking, yeah, sure, but what is causing that immune system to do what it's doing? And that's what I talked about in the just previously, is about what are those things that are causing the immune system to do it. We need to eliminate those type of things. But conventional medicine doesn't go into that. They're just, what their main thing, a rheumatologist, for example, is going to prescribe you immunosuppressive medication, and then their main goal is to make sure that immunosuppressive medication doesn't cause too much harm to you. They're going to check your blood work, like your liver, your kidney function, etc., and make sure those things aren't getting destroyed because they can with the medications they're doing. And that's it. And you're going to stay on these medications for life. And then you're going to have all these other increased risks that we just talked about. So let's start with rheumatoid arthritis. So let's say a patient comes in to me, which isn't very common. Usually they have been already treated with some type of systemic immunological medication that is suppressing their pain, even though they're coming to me because they probably are still in a lot of pain or they want to get off of it. But many of my patients are already on it. But if I have a patient that comes in and they are having severe symptoms of rheumatoid arthritis, Many times I might get to the point of prescribing a certain medication to suppress it for the short term while I'm working on going after the causes. If it's not really severe and it's just kind of in the beginning stages and I'm not seeing things go crazy, I'm going to be prescribing certain herbs that I see very effective on going after treating arthritis, which is like high doses of turmeric or boswellia, which is frankincense. I use fish oil. You do systemic enzyme therapy. These things are highly effective too for moderate and less severe rheumatoid arthritis. If it's really severe rheumatoid arthritis, I'm going to usually prescribe some type of medication, usually Humira or something like that, to stabilize them while we're working on the causes, and then we're going to wean them off of those medications. So osteoarthritis, I rarely have to resort to like ibuprofen or aspirin or anything like that. The turmeric, the boswellia, systemic enzymes, the fish oil, all these things are highly effective at going after the osteoarthritis. And then I also love to do regenerative injection techniques depending on what area they have the osteoarthritis. Like say it's in the knee, I like to do an injection in there that will regenerate and heal that cartilage to prevent them needing to get any type of surgery in the future and decrease that inflammatory response and decrease the pain in that way. If you want to learn more about arthritis or other medical conditions like this one, click my video to the right. I'm Dr. Jake, and I'll see you there.